Have you noticed your lower back slowing you down more than it did a decade ago and wondered if this is just what happens after midlife?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at the sharp rise in postmenopausal low back pain, why your risk climbs after menopause, and what you can do today to protect your spine and your long-term health. I'm a health and wellness host, and I'll guide the conversation with clear takeaways you can act on.
I'm Alara Sky. We're focusing on new analyses showing that cases of low back pain among women over 55 nearly doubled between 1990 and 2021. The increase is driven largely by aging populations, but women after menopause face a higher burden than men the same age. You also see rising years lived with disability, underscoring how persistent back pain limits daily function and quality of life.
The numbers are striking. By 2021, an estimated 176.8 million women 55 and older were living with low back pain, with new annual cases reaching roughly 70.3 million. Your individual age-adjusted risk hasn't spiked dramatically, but more people are affected because the global population is older and larger. Even so, women after menopause had about 1.78 times more new cases than men, and 1.86 times more total cases that year.
Let's connect this to what changes in your body. During and after menopause, you experience bone loss that weakens vertebrae, discs that lose height and hydration, and a decline in muscle mass that normally stabilizes your spine. Abdominal fat tends to increase, shifting your center of gravity and load on the lumbar region. Sleep becomes more fragmented, pain sensitivity rises, and mood shifts can amplify pain perception.
Immune signaling also drifts toward higher baseline inflammation. That low-grade inflammaging affects joints, tendons, and nerves, making pain more persistent. Hormonal balance changes matter as well. Estrogen and progesterone support bone, cartilage, muscle repair, and inflammatory control. After menopause, lower circulating levels reduce tissue resilience and slow recovery, leaving your spine more vulnerable to stress and everyday strain.
Many women feel the first sustained twinges earlier, during perimenopause. Hormone fluctuations in the 40s can raise pain vulnerability before periods fully stop. Large cohort studies show back pain prevalence rising through the transition, with some data indicating early perimenopause has the sharpest increase. Across countries and cultures, that pattern repeats, often alongside higher body mass index.
Chronic low back pain does not exist in isolation. It's strongly linked to other conditions you care about. Cardiovascular issues such as high blood pressure are common in those with persistent pain. Respiratory conditions appear more often. Metabolic disorders, including diabetes and dyslipidemia, show up with greater frequency, as do anxiety and depression. Functional decline accumulates when walking, standing, and dressing become harder.
The encouraging news is that major contributors are modifiable. High body mass index is the top modifiable risk factor for disability from low back pain globally, followed by occupational exposures and smoking region matters. Excess weight has the largest impact in high-income settings, and physically demanding work weighs more heavily in low and middle-income areas. But in both cases, targeted changes make a difference.
Let's translate that into action. Start with movement you can sustain. Walking is one of the most effective ways to interrupt the pain cycle. Begin with 10 to 15 minutes at a comfortable pace, 5 to 6 days a week. If your pain rises above a 5 out of 10, ease off, but keep moving. By week 2, aim for 20 to 25 minutes and include 2 gentle hills or short stair bouts if you can tolerate them.
Next, change how you sit. Staying in one position too long deconditions the muscles that stabilize your back. Every 30 minutes, stand up, stretch overhead, or take a brief lap. If you work at a computer, set a timer to nudge these breaks. A standing desk or walking pad can help you vary posture and keep the spine engaged through the day.
Core and pelvic floor strength are essential. Your core includes abdominals, lower back, hips, and the pelvic floor. Aim for basics 3 to 4 times per week. abdominal bracing with breath, bridges, sit to stands, and gentle hip hinges. Do 2 sets of 8 to 12 repetitions. If you notice urine leakage with coughing or jumping, or pelvic heaviness, that suggests your pelvic floor needs focused attention. Seek guidance from a qualified clinician.
Address stress to reduce muscle guarding. Short relaxation breaks help unwind the tension that accumulates in your back. Every few hours, close your eyes, take a long nasal inhale, then a slow mouth exhale. Follow with a simple movement, arm lifts, shoulder circles, or slow lunges. You're easing your system out of a tense state and reducing the hormonal drivers that heighten pain.
Nutrition and weight control matter because excess weight increases spinal load. Prioritize steady improvements in food choices and avoid ultra-processed products that include seed oils high in linoleic acid. Choose nutrient-dense options that support cellular energy and muscle repair. As weight eases down, movement becomes easier, posture improves, and your back tolerates daily demands with less strain.
Sleep deserves attention. Disturbed sleep lowers pain thresholds and slows recovery. While the article emphasizes movement and daily patterns first, recognize that consistent quality sleep supports pain regulation. Protecting a regular schedule and calming pre-bed routines will help you respond better to the other steps you're taking during the day.
Be aware of how these changes build on each other. Walking promotes fluid exchange in discs and joints. Posture variability keeps stabilizers active. Core and pelvic floor work restores support. Breathing breaks reduce stress-driven bracing. Nutrition and weight control lighten mechanical loads and metabolic strain. Together, they reduce risk, make flare-ups less frequent, and protect independence.
If you're in perimenopause or recently postmenopausal and you've been told back pain is just part of aging, question that assumption. The biological changes are real, but so are the levers within your control. Early recognition, targeted movement, and consistent daily habits can shift your trajectory before pain becomes a long-term limitation.
Here's your challenge. Over the next 7 days, walk 10 to 15 minutes on 5 days. Set a recurring 30-minute reminder to stand, stretch, or take a lap. Complete 2 core sessions with bracing, bridges, sit to stands, and hip hinges. Schedule 3 2-minute breathing breaks each day. And remove ultra-processed foods made with seed oils from one meal you eat regularly. Track what changes in your pain, stamina, and posture. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.